Good morning, good afternoon, good evening, everyone. My name is Katie Murphy, and as the interim director of the Moving Minds Alliance, I have the great pleasure of welcoming you all today to the third episode of our Nurturing Futures series, Inclusive by Design, Reimagining Holistic Early Childhood Systems for Children with Disabilities in Crisis Settings. At the Moving Minds Alliance, we work through collaborative advocacy and catalytic partnerships to ensure children ages 0 to 8 in crisis settings have equitable, dignified access to care and support they need to survive and thrive. Across conflict, displacement, and protracted emergencies, millions of young children face risks to their health, learning, and well-being. Of course, those risks are compounded for children with disabilities, who are far more likely to experience exclusion, discrimination, and neglect because of overlooked policies, inaccessible data, and a lack of intentional planning. Today, we have an amazing lineup of speakers that will help us think through how we can advocate for disability responsive systems. This conversation builds upon our new 2025-2030 strategy, which we have just launched, and we're very excited to share with you all today. We hope that you take the time to check it out. It's called Reimagining Early Years Crisis Response, which opens our alliance to deeper partnerships with disability rights advocates and others who are really committed to this issue. So please, if you are interested in exploring membership, reach out to us. Check out our website. We will also have a newly revamped website coming soon, so you can explore that as well. We also invite you to sign up, ensure that you're receiving these updates, and also to share feedback after this webinar ends. Your input is really critically important to us. I also want to acknowledge that while we intend to have everything be inclusive by design, unfortunately today we were not able to secure sign language translation. So we recognize that this is not truly as inclusive as we would hope and aspire for it to be, but ensure that we are committed in the future to improving on that. With that, I want to hand it over to our moderator, who will also introduce the speakers, Julius Mvenyi Ntobuah. I hope I'm pronouncing that correctly. Julius is the founder of Newcomers with Disabilities in Sweden, advocating for full inclusion of refugees and asylum seekers with disabilities throughout the integration journey. He also serves on the UNHCR Advisory Board, working with organizations led by displaced and stateless people and bringing that lived expertise to global policy advice. He is a mental health ambassador and is also a member of the steering committee for the Task Group on Disability Inclusive Disaster Risk Reduction and the European coordinator with the International Disability Alliance, advising on sustainable development and inclusive DRR. Julius, we're honored to have you with us. Over to you. Thank you.
Thank you, Kate, for the wonderful introduction. Good afternoon, everyone, and welcome to episode 3 of the Nurturing Futures webinar series, Inclusive by Design, Reimagining Holistic Early Childhood System for Children with Disability in Crisis Setting is our topic for this third episode. A big thank you to the previous moderators and panelists who hosted the last 2 episodes. They did a fantastic job. There are more episodes coming up. I encourage everyone to sign up. Just keep your eye open on Moving Minds Alliance website, or you can sign up to get an update. These are not webinar series to miss even one episode, as you will be edified and have more tools as we embark on this journey to advocate for children with disability in crisis setting. As Kate rightly said, my name is Julius Ntobuah, and it's an honor to moderate today's session, today's discussion with experts who works in very challenging situation. Today's topic touches me very deep in my heart, as I am a refugee with disability myself. I promise to do my best to accept as many questions as possible as the time permits. Nurturing Future webinar series is a bi-monthly webinar that brings together some of the diverse voices that you as audience are going to hear from today. This episode will be an opportunity for us all to share our experience and be actors for change for children with disability in crisis situations around the world. Around the world today, humanitarian crises are shaping childhood, was not the case, but this is an unfortunate situation. Today, more than 43 million children have been forcefully displaced by conflict, persecution, or disaster. Within this staggering figure, an estimated 7 to 9 million are children with disabilities, though the real number is likely much higher because disability often goes unreported in emergency. In refugee camps, war zone, and disaster-affected regions, these children face double and even triple discrimination. They are discriminated first as refugees, as children, and as persons with disabilities. Imagine a young child with cerebral palsy in a crowded refugee settlement, or a young child who has hearing impairment, struggling to get clean water that may depend on navigating uneven terrain or long queues, or a child who is deaf, unable to hear emergency announcement or participate in informal learning activities in the camp. For many disabled children, basic services such as healthcare, early childhood education, psychosocial support are simply out of reach. The result is not only immediate hardship, but lifelong developmental setbacks that can affect health, learning, participation for years to come. Despite the urgent need, early childhood development remains one of the most underfunded areas of humanitarian response. Research tells us that the first 8 years of life are the most critical for brain development. Yet, programs for young children with disabilities in crisis settings are often overlooked or treated as a special add-on rather than a core priority. This neglect leaves family isolated, children exposed to heightened risk of exploitation, violence, and preventable diseases. But there is hope. Moving Mind Alliance recognizes the urgent need to address this gap and advocate for integrating early childhood development into emergency response efforts. The Alliance works through collaborative advocacy and support catalytic change focused initiative to promote equitable and dignified access to care for children from 0 to 8 years in crisis situation around the world. Today's webinar is about turning this isolated success into a systematic change. We will hear from field experts, caregiver, advocate who are challenging structural barriers and designing programs that are inclusive by design, not as afterthought. As we begin, I invite you to keep one central truth in mind. Every child, I repeat, every child, no matter where they are born, whether they can walk, hear, or see, has the right to play, learn, and grow in safety and dignity. Our shared responsibility is to ensure that humanitarian response honor that right. I will now like to invite us to our main protagonist to hear from a child, a very special person from the war-torn Gaza. So please, can you play us that?
اسمي وفاء فضل صالح أبو حبل، العمر 37 سنة. نزحت من غزة. أنا أم ل3 أطفال معاقين بشلل دماغي، يعانين من مرض هايبرغلايسيميا، نقص أنزيمات في السكر، السيولة في الدماغ في الجسم كلها بتتخربط، بتؤدي لضمور وتشنجات وإنه يغيب، والتشنجات المستمرة هذه دائما الولد بتشنج وبغيب، لا علاج لهم، لا حياة ولا أي إشي من مقومات الحياة، ولا إشي متوفر لهم، وضعهم صعب كتير. مستحيل عند الولد هذا يدوق أي المي العادية، ما برضاش يدوقها، لو بضله عطشان برضاش يدوق المي العادية، بيعرف المي العادية من المي الحلوة. إذا كانت موجودة البامبرز أنا بلبسه له، إذا ما كانتش موجود راح يتبهدل وراح يتبهدل المكان وحياكلوا وسخهم. صرت أنا أتواجد في البامبرز قبل الأكل، بدور على البامبرز قبل الأكل، بعدين بفكر بأكلهم. وهينا اليوم الثالث وإحنا مش شايفين المية. لو أجى الولد بهدل حاله أنا بدي أنزل على البحر أجيب من مية البحر عشان أنا أنظف ابني، عشان الله يعزكم ما ياكلش وسخه. حياته إنه 24 ساعة نايم ومغيب، بصحاش من النوم، بصحى بس في الليل. الليل الناس بتحملوش أصواته، من آخر الدنيا بسمعوا أصواته الناس. علاج مش موجود، مخدر لازم ياخدوها ويناموا عليه. الأكل اللي أنا بجيبه من التكيات أحيانا هم ما برغبوهوش، بصيروا سهال عليه. أحيانا بمسك علبة الحمص هادين بفتحنها وبياكلنها بالمعلق، لما بلاقينش حاجة ياكلنها بضطر كل واحدة بالمعلق. لما نعطي واحدة علبة بدين كلها ياتن كل واحدة علبة، لكن ببقاش معي في ايدي أحيانا الشيكل إن أجيب لهم مثلا خبزة أشتري لهم، بقعدوا بالأربع أيام وبالثلاث أيام لما يلاقوا الخبزة. أحيانا برمي لهم خبز زي الكلاب ناشف عشان ياكلوها وسكتهم فيها. أحيانا بنتي بتقف لتاع المية، والله بتنان، والله بتنان، بزعل عليها بتنان. بقول لها الزلمة هذا لتر المية غالي، روح جيبي شيكل. والله بخجل لما بقولها إياه قدام الناس، ممكن يصيحوا فقعنات من الصياح. كل ما طالب أمنية حياتي بس إنهم أولادي يطلعوا من المكان هذا، يسافروا يكملوا علاجهم ويسافروا ويكملوا حياتهم برا. هاي أمنية حياتي، أنا مش طالبة حاجة. الناس بيطلعوا بنفر، بيطلعوا بولد بولدين بثلاثة سلمين، أنا بجري فيهم 3، لكن بشحد الواحد شحد عشان يجي يحمل معي أولادي. أحيانا والله العظيم والله العظيم والله العظيم بمصاري. أولادي لما أي واحد بده يحملهم بكافئه بمصاري عشان يحمل ابني معايا.
Please donate now and join us in saving and rebuilding.
Okay, thank you for that wonderful video. So we'll now go to an expert who is based in Gaza. But before that, let's get a rundown of our program. We have opening and reflection and pre-record video of the child. Now we're going to go to Ihab Abu, who is a disability researcher with MMA expert group, advisory expert group in Gaza. And after his video, we're going to have a panel discussion where we're going to have expert representative from Uganda, Lebanon, Kenya, and then we're going to have a response from Girma from UNHCR, Division of Resilience and Solution. And then we're going to take your question, as many as time permit. And then after that, we'll have a closing remark by Vibhu Sharma, who is also a researcher and a consultant on the disability inclusion with the award. And then she will give us the closing remark and recap. And we'll have the survey. Lola at the end will post the survey for us, which will just take 60 seconds to complete. So for now, let's move on with the program with Ihab, his reflection.
Hello everyone, this is Ihab Abward from Gaza. I'm a disability researcher and working here in Gaza, and thank you for inviting me to speak in this webinar. When I'm invited to discuss disability inclusion in humanitarian system, I posed from Gaza here. These systems often looks like us, a delay and profound failure to see the most vulnerable. Today, I share reflections seen here through the eyes of those the world has made invisible. And we'll start with the myth of inclusion, and especially in Gaza Strip, in Gaza Christ, which is currently happened here in Gaza, the genocide. In the text box, disability inclusion is a box to be ticked. In Gaza, the box remain unchecked, unfortunately to say that. Let's imagine for the moment about the continuous evacuation orders which is instructed by the Israeli forces for all of the people who are disabled in all of Gaza Strip. You are elderly with limited mobility. You are wheelchair was crushed and shelter has no ramps. So do you feel that how is miserable to move due to the evacuation order to save and protect your life? The second one is the food line. Your child is blinded, and destruction and distribution is chaotic. No guidelines. It's a traffic. There's are overwhelming here in the distribution. There is no any kinds of instructions. You are pushed to outside and you stay hungry. The child, you are outside, the child is cannot speak. With constant pumping, it creates sensories due to the shock. So there is no safe places, unfortunately, to say that about these three types of disabilities, which is the number are increased and increased every day during the current genocide here in Gaza. For the overage people, if we are talking about the humanitarian system, to build the hypothetical beneficiary, mobility, sight, and hearing independence are should be by default for all the people. But we are now talk about all the difficulties which is the overaged people are facing every day in getting all of their needs, daily needs. So it's really terrifying to understand what is happening. If we are talking about more than tens of thousands are amputated, including thousands of children with future forever, and hundreds of thousands are mental health crisis and need rehabilitation, severe PTSD, anxiety, depression, and are suffering. There is no infrastructure for the people, no schools, no hospitals, no water, no access for hygiene or wash systems. So we are talking about all of it as constraints to accessibility for the people, especially for the normal people and mainly for the disability persons. So we can have two critical lessons to learn from this happening situation: disability of the dynamics, and we are expertise of our experience. So we can reframe the current from token inclusion to transformative justice for the people. Inclusion must be the foundation of humanitarian action, not an added one. So nothing about us without us. So if we want to reorganize the priorities here, we are talking about the direct partnership and co-leadership and resources access in order to reframe the disabilities policy here in Gaza, in addition to collaboration between the NGOs and INGOs. So this is a call to action from the Rappel of Gaza. We see clearly our current model are failing. We must remain and reimagine the humanitarian response through the lenses of those most marginalized. The most effective response are not always the international agencies, they are the local disability persons, organizations, the families, and the community network. Thank you.
Thank you so much, Ihab. Now we'll move to our panel discussion, which will have our first panelist is Myriam, Jaafar. Myriam is a disability inclusion specialist based in Lebanon with emergency response, especially for children with disabilities. Myriam, I would just want to know from you, your global view on the video and what Ihab have said, but also I would like to know from you, do all children in Lebanon, regardless of their background or status, receive the same type of service and are treated equally?
Thank you, Julius. First, let me thank you for having me, and I'm delighted to join this panel today. I hope our discussion will spark new insights and approaches that truly meet the needs of all children, regardless of their circumstances. Please allow me to say that no context is comparable in any way to Gaza context at this level. And after listening to what Ihab said, I would like to also add that emergencies are not all the same, and the ground is not always prepared in the same way. Therefore, the importance of an idea that I will share later on, which is being inclusive by design and to be really focused on the context and its specificities, what we call now localization, contextualization, etc. Back to Lebanon, the Lebanese context is very specific too, as not all children receive the same kind of support and services. While the Lebanese government offers services to all children in terms of health, education, and more, it is mainly known that for Palestinian refugee children who've been like children of other generations who've been there in Lebanon for so many years now, UNRWA plays a key role. For Syrian children or other nationalities, civil society, NGOs or INGOs also play a key role. As for the Lebanese children with or without disabilities, several government entities are responsible for providing services to those aged 0 to 8 years, including the Ministry of Health, the Ministry of Education, and the Ministry of Social Affairs, MOSA. I can say more whenever you you prompt me. I'm happy to add. Thank you, Julius.
Thank you very much, Myriam, for that insightful both on Gaza, on children in Lebanon. I will now go to James. James, your organization work with refugees with disability. Can you give us your context, seeing that video and also hearing from the previous two speakers? How is it with children in the camps, children with disability, but also are current donors accountability framework sufficient tracking disability inclusive outcome for young children with disability in humanitarian setting? If not, how can this be strengthened? James, you have the floor.
Yeah, thank you so much, Julius. Actually, I'm glad to be here on this discussion. I'm called James Muombamungu. I am from Uganda, a refugee with disability, and I serve as the executive director at the Association of Refugees with Disabilities, ARD. Here in Uganda, actually, we have the refugee sectors where refugees stay in the refugee settlement. And actually, if we talk about the early childhood in the Ugandan refugee settings, early childhood centers are often established quickly after the crisis, and where children run, play, and learn. But in most cases, you find children with disabilities like blind or deaf child frequently remain at home. This is because these children are excluded because centers lack braille, sign language support, or trained caregivers. In most cases, you find when refugees even are brought in the refugee settlement, you find they don't consider the aspect of inclusivity. You find they are put in an area where children cannot even integrate with other children, or where children cannot even reach schools, where children cannot even reach these ECD centers, and you find they are mostly left behind. And of course, in the refugee settings in Uganda, actually in the curriculum of Uganda here where we stay, ECD centers are not formally accepted in the country. So they are there, but with the private entities having the ECD centers. But you find even these ECD centers are not inclusive for children with disabilities and for refugee children with disabilities. If you find there might be children without disabilities hardly accessing education or the early childhood education, then when it comes to children with disabilities in the refugee settings, it is something that is worsening. And imagine with the current situation where humanitarian support is totally cut off. Now, children are really suffering and not attending education, because actually here in Uganda, I've never seen, I personally, like an early childhood education where these children can learn from. Because take an example of a blind child or a deaf child. These are the children that even attend school at the later age. Find the child has gone to school at the age of 10 plus, and yet the language we speak at our homes is totally different from what they speak. For example, a deaf starting primary one, you need to know the sign language, because even an abled child to go to school, you cannot go when you cannot speak. And the language these children can speak is the sign language. If we come again to the blind children, these are children that need to go to school having some skills on like the braille machine, the JAWS softwares where necessary, but you find they go at school at the later age without any knowledge about their language that they are supposed to speak. Yet in their home, like the deaf children, they have their family side languages that is not used in the curriculum, of which is this needs to be really emphasized. And if you look at the humanitarian actors, maybe here, humanitarian actors, you find we in the crisis we tend to consider children or persons with children with disabilities or the broader children, and we forget that their caregivers, their mothers, are the center of their success, whereby we could also think on how best can we capacitate these caregivers in a way that they can support these children. Because even if we come up with humanitarian support, when the parents or the gatekeepers do not put hands in supporting, in taking care of these children, in understanding what is needed to be put in place in order to make these children successful, of course, the humanitarian work will fail. So we need to put the parents and caregivers in the center of nurturing these children with disabilities. Thank you. Maybe I'll add on if time allows. Thank you.
Thank you, James. Thank you very much. Before we go to Stephen, I would like to come back to Myriam. You gave a very brief context, but I would like to know from you if you have something to ask again in the add on the context of Lebanon when it comes to children with disabilities.
Yeah, thank you so much, Julius. I'm going to paste in the chat a few resources. One of it is Status of Young Children's Development and Nurturing Care in Lebanon, Identifying Disparities and Risks to Inform Policy and Program Actions. It was published by UNICEF in 2024. However, it reflects the reality at that time, but not the full picture, as the war has since affected many regions and a large number of children. Also, it is like the Lebanese context continues to change due to protracted crises. If you know, there are economic collapse, political instability, the impact of the Syria crisis, recurrent security tensions, and most recently, the large-scale war on Lebanon that began in September 2024. And it is universally acknowledged that there are threats to children's development during pregnancy and birth, as well as when they are newborns, and there are newborns, infants, and toddlers. So it's in a such challenging and unstable context like Lebanon, children face multiple risks. Some children are either born with disabilities, while others acquire them because of war and other factors. The severity of a disability can also be compounded by either lack of stimulation, limited or low quality interventions, absence of early support, or the high cost of services, and many others. There's also situation analysis of disability in Lebanon. I will share the link for it in the chat, which was made by the Ministry of Social Affairs in collaboration with UNFPA and UNESCO. And they must have developed a first national strategy on persons with disability. While the strategy is largely ready, it still needs to be officially launched. And this is a framework that is designed to protect and promote the rights of people with disabilities, to coordinate development, etc. But also, I will paste that in the chat. But given that this webinar invites us to reimagine holistic early childhood systems for children with disabilities in crisis settings, and given that the Lebanese context is a bit complex, and I'm saying that because I already highlighted that not all children on the Lebanese territory receive the same kind of services, allow me to pose a few questions that may directly or indirectly reflect the realities faced in this context. First question, do all children with different types of disabilities have the same needs, or do their needs vary? Are we truly including all children, no matter the type of severity of their disabilities? Are we providing responsibility for children with avoiding responsibility for children with severe disabilities by saying our programs and staff or schools and classrooms are not equipped? Is physical accessibility enough to claim as that an approach is inclusive? Are we genuinely inclusive if we rely solely on providing specialized services and assistive devices? How can we ensure that early intervention becomes a mandatory and standard component of all programs? Also, how can we make services continuous and sustainable, not dependent on project funding or high costs covered by caregivers? How can we ensure that every staff member working with children is trained in inclusion principles, just as they are trained in child protection? Shouldn't inclusion be considered a core aspect of safeguarding children's rights? Last two questions. How do we ensure programs are well monitored and staff and caregivers are continuously supported? Is having an inclusion focal point within a profession? And can inclusion be treated as just a top-up to an existing role? Finally, there are a few points that I can share at the end. But again, food for thought. Are we able to cater for the needs of all children in emergencies while the needs become really basic? That's a question. Thank you, Julius.
Thank you very much, Myriam, for those thought-provoking questions and very insightful presentation there on the state of children with disability in the Lebanese context, but also in the global context in crisis situation. Now, we will go to our next panelist, which is Stephen Mwaura, Senior Education Advisor at Lakara Mission International, LM. Stephen, I would like you to really, give us your context, your Kenya context, specific context, but also keeping an eye on the global view, given the previous panelists, what they have said in Uganda, in Lebanon, and also in Gaza. But while keeping an eye on the global view, I also like to ask you this question. Why is a cross-sectorial holistic approach important to meet the need of children with disability in crisis setting? Stephen, you have the floor.
Yeah, thank you very much, Julius. I'm happy to be here to share my experience as a teacher, alongside being a teacher, and also to learn from the discussion. Reflecting on, first of all, on the video that we saw first, I think it reflects on what happens to the caregivers, to the parents, the challenges that they undergo. And what I can say from there is that the needs of children with disabilities, or needs of all children, are interconnected, whereby a child requires education, a child requires good health, good food, and all that. And then when you come to presentation from Ihab, my reflection is show the problems that are faced by children with disabilities in crisis settings. Just to mention a few about the physical barriers where children with mobility problems, devices are not able to maneuver within the camps, communication barriers, and then protection, and all this will require collaboration. Now, coming now to your question about cross-sectional holistic approach, let me start with a very simple truth. Children, whether they are with disability or not, they do not live in silos. So my question is, why do the systems, the services we give are given in silos? In crisis settings, children with disabilities, they face compounded challenges, and to meet their needs, we need to change the way we do things. And according to me, with my experience, I think we need to have holistic systems. And what do I mean by that? The reason why I think we need holistic systems so that we can be able to meet the needs of children with disabilities in crisis setting. One of them is that children development are interconnected. As much as children require health and education at the beginning, they require the two of them, but more, they also require other services. They require protection, they require good nutrition, and also they require parental care. So when we have holistic system, it acknowledges that the development is multi-developmental and ensures the support for the whole child. We don't look at the child in isolation. We look at the child's health, the needs of health, both education, parental care, and all that, and especially in crisis settings where we have a lot of challenges. The other thing why we require a holistic system is that it closes the gaps that emergencies explode. Crises normally shatter systems and amplify risks. So when education, health, and protection section work in isolation, children with disabilities fall through those cracks. And a coordinated cross-sectoral system acts as a safety net, ensuring that when one service identifies a child, they are seamlessly connected to all the others where they need. Something else I would be able to say is that early childhood is a very critical window, like we heard from one of the speakers. The first 5 years of life are foundational for development, for learning, and also socio-emotional growth. So a holistic cross-sectoral approach ensures timely and comprehensive interventions that support long-term outcomes for the child. And then as I go on, holistic system and approach promotes family-centered support. We have seen in the video from that mother of the child with a disability. Families are the backbone of resilience in crisis, but they often struggle to navigate through the disconnected systems in the camps, in the refugee camps, IDP camps, and all that. So holistic collaboration helps the families, the caregivers, and all the other workers to access the services. Could be financial assistance, could be inclusive education, could be health, social support, and all others without a problem. So a holistic system ensures caregivers, the parents are empowered and they are not overwhelmed to nurture their children even under stress. And then something else I should be able to say is that when we have a holistic approach, it avoids service gaps and duplication. When sectors don't coordinate, when we are giving humanitarian services, children fall through the cracks. One agency might assume that another one is handling a certain need, while no one actually has done that. So when you come up with a holistic approach or cross-sectoral approach, it reduces duplication of services and improves coordination and maximizes the impact, as especially vital in resource-constrained crisis settings in refugee camps and all others. If sectors work in silos, we reach fragmented support where the children with disabilities and their families will continue to suffer. Something else for holistic system, it makes inclusion visible and also very accountable. Without sharing data, children with disabilities remain invisible. We need cross-sectoral collaboration whereby it enables shared data system that track the child's progress across the services. Where we will talk about the data, we need disaggregated data on children disability, maybe their age, and also gender, so that we can be able to know the needs of these children. And then something else when you talk about holistic approach is when we talk about holistic approach, it's not just practical issues. It is a matter of rights. Inclusion is a right. And it aligns with the global frameworks like the CRSBB and also SDG4, especially the target 4.2 of SDG4 emphasizes that every child, including those disabilities, should be able to get good preschool or our child development so that they are prepared well to join the primary school. And then when you have a holistic approach, accessibility is not just about ramps. Now, because we need to have all the systems right from the beginning. But in most cases, the system that we have in our refugee camps and all others, normally they are developed not having to disabilities in mind, but mainly for the average child, whereby you see probably when they see that they realize that a child who require mobility devices, now they try to think about a ramp. Otherwise, it should have been put right from the beginning because you never know what happened after that. Otherwise, when you have it like an afterthought, it's not quite good. And as I close, Julius, I would be able to say that inclusion is not the responsibility of one sector. It is shared, it's a shared commitment. And by breaking down silos and working together, we can build a very coherent, very resilient systems that truly nurture the future of every child, especially those with disabilities in crisis settings. Thank you, Julius.
Thank you very much, Stephen, for that very great elaborative answer and also your reflection. Now, we'll go to Girma, who is an educationist working with UNHCR in the Department of Resilience and Solutions. Girma, without necessarily giving you a response to the situation in Gaza, because we know there's a different agency responsible for that, but I would like you to just give us your answer after hearing all this context in Lebanon, in Kenya, in Uganda. What can you say as an educationalist, as a response, and also in just putting a general eye on the video and the reflection coming from Gaza as well? Over to you, Girma.
Thank you, Julius. Thank you for having me to this discussion. Yes, as you mentioned, my role is I'm the education officer for UNHCR based in Copenhagen. So as the previous speakers mentioned, actually, they have really indicated all the challenges that the refugee children faces, mostly in resource-constrained refugee settings. As James said, and all other panelists indicated, the situation is really dire for children to access education, to access health services, and others. But just to start with what we do as UNHCR, and then maybe for 1 minute I go into the challenges that others have already highlighted. As UNHCR, we work to promote the rights and inclusion of refugees, including also people with disabilities, to ensure that their protection is maintained, and then providing accessible services, particularly during aid distribution, information, and actually improving their participation in community life. So as UNHCR, there is a registration that happens where refugees arrive, and then people with special needs, particularly children with special needs, including children with disabilities, would be identified. So through this identification, actually it is to link them to the different services that are available in the refugee setting. Of course, as James mentioned, in the refugee setting, for example, in Uganda, where refugees are actually settled, it is already with resource constraint, and then our access to services such as education is very much limited. But then this is generally for refugees, but when it comes to children with disabilities, we can see some unique developmental needs. For example, refugees with disabilities face multiple layers of vulnerability, which comes with displacement. And of course, displacement is compounded with trauma, and of course, the disabilities that they have, mobility or many other disabilities that they face in the camp. So there are environmental issues, there are also attitude issues, there are also other systemic barriers. As I mentioned, for UNHCR is to make sure that everybody is included into the services that are available, either in the camp setting or under the national service providers. But because of many constraints that we see, and when children are not given the opportunity to access these services, of course, children with disabilities are having layers of these vulnerabilities. As Stephen mentioned, of course, we really, this alliance and many other organizations that we work with, we're trying to promote access to services. Then, of course, at the national level, the humanitarian response should be able to respond to the different needs of children with disabilities. And of course, we should have explicit plan for children with disabilities, not only for education, but also for other services, access to other services. Data sharing, as Stephen mentioned, do we have really solid data on the needs of the children? As also James mentioned, when we talk of disabilities, there are many different types of disabilities that can actually puts barrier or children to access the different services. So the advocacy that we do as UNHCR, but also with organizations that we work with, is to make sure that children with disabilities have access to education, to health, psychosocial support, and other services that are available in the camp. Yeah, thank you so much. Back to Julius.
Thank you very much, Girma, for that very important advocacy that you are doing with UNHCR. Thanks to all our panelists. It was wonderful having all of you here. And please don't go away. Now it's time for question and answer. I'll coordinate with Lola together to see if there are any questions in the chat. If not, you are welcome to raise your hand and we'll give you the mic to ask your question to our very wonderful, fine grain of experts who are here as our panelists to answer any of your questions. So we have a couple of minutes on that. before we go to the next segment of the program. So, any questions, Lola, or any hands up?
I see one question now. You can see it at your end as well. It says, is there any region that successfully integrated disability into national emergency action plans or made significant progress towards this? How can we engage ECD actors to utilize lessons from there for improved advocacy? So is there any model region that has done this well that can be emulated, or we are all still learning globally? That's the question.
Okay, thank you. Maybe Myriam, you want to take this? You are muted. We can't hear you.
Or pretty much anyone on the panelists who wants to speak to it. The question is in the Q&A, and you can view it as well. Alternatively, let me also read the other question here. Okay, some questions are popping in now. Victoria, World Vision International, she says, who owns outcomes for children with disability across health, education, protection, and WASH in this crisis? And what mechanism would ensure delivery isn't no one's job? That's a question for reflection. Then I will look at the other one. Here says, with the current global funding gap, how can we ensure that the needs of children with disabilities are prioritized in humanitarian resource flows? And then Susan says, many NGOs I know say that they would like to do more or be more inclusive for children with disability, but they lack funding for the additional resources. Are there any emergency funds dedicated to expanding disability inclusive programming? So this is about 4 questions in all, and our panelists may choose each one they may want to speak to. Over to you, Julius.
Yes, thank you for reading out the question. Now I'll go back to our panelists. You are free to unmute and then answer any of the question. We have like 3 minutes to round up this. Unfortunately, the time constraint. Go ahead.
Julius?
Yes, we can hear you
Myriam
now.
speaking.
Yes, go ahead,
Yeah,
Myriam.
thank you. I'm sorry, my internet was unstable. If I can just to give an idea about the programs that I already worked with in Lebanon, it would also kind of answer some of the questions or also pose more questions. The idea is that most projects that I worked with, first of all, take inclusion as a component rather than mainstreaming inclusion or disability inclusion across the whole projects or programs. 2, inclusion is rarely about children with disabilities. It can be for gender inclusion, cultural inclusion, etc., but it's rarely dedicated or fully focused on children with disabilities. And when it is about children with disabilities, in many cases, unfortunately, it focuses on the idea of providing specialized services, which can be paid as services outside the program, rather than providing inclusion or making sure that whatever project or whatever is being done with the children is inclusive. And I say that for children aged 2, 3, 4, 5, whatever, depending on the if it's ECD or ECE or older children. So that's an issue. And once the project stops, services stop as well. So again, that was the idea behind my question about continuity. Thank you, Julius.
Okay, thank you so much. We are running behind time, so I guess we'll take the next question just as a reflection and go back maybe the panelists can send us emails to you. We can email the question to you, and you send the answers, and then we can circulate it within or put it on the website, or maybe send it as an email, because we just have like 3 minutes to round up now. We don't want to take many people's time. So thank you very much for the panelists, and thank you for those who asked the question. We'll try as much as possible to see how our panel can answer it in another time. So now I will hand the the baton to Sharma, who is going to give the summary and main points, and then the action point of this webinar. So Sharma, you have the floor.
Thank you, Julius, and thank you so much to uh, Moving Minds Alliance and also to all the speakers for the powerful reflections shared today. It has really been an honor to listen to different experiences coming from different regions with different perspectives. Each of it highlights not just the urgency, but also the possibility of making early childhood sessions truly inclusive. I think a clear message stands out in today's conversation that inclusion cannot be an afterthought and that systems must be designed with inclusion at their core. Because as we have noted today over and over again, every missed opportunity creates a lifetime exclusion, especially for children with disabilities. Um, and I've also seen today how humanitarian systems built for the quote unquote average child often leave behind who need them the most, and how local communities and organizations of persons with disabilities um, should not be treated only as participants or as recipients of aid, but as leaders in shaping the solution. All of which strongly echoes that early childhood development should not be siloed, and a holistic cross-sectoral approach, one that links education, nutrition, health, protection, and psychosocial support um, is essential. And obviously, that localization must move from a rhetoric to reality by reaching the families and organizations that are closest to the children. So at their world, through our Act for Early Years campaign and the recently published paper called All Means All, embedding disability inclusive financing for early childhood development, we have called for embedding disability inclusion as a fundamental principle of early childhood development and early childhood education. There are practical, scalable approaches, but they must be implemented so that we can reach all children, and they need to be implemented with real intention. I think the takeaway is very clear from today's webinar that we must move away from token inclusion through transformative justice and embed disability inclusive responsiveness at the core of every resource we design and develop. And we need to resource the leadership to the organizations or persons with disabilities who are already innovating under the most difficult circumstances that they are operating in. Finally, I think that the lessons we learned today are not just perspectives or lessons learned, they are our roadmap. And with courage, collaboration, and real intention, I'm sure we can build or nurture futures that leave no child behind. Thank you so much.